Welcome everybody. I hope you're having a great time at the Expo. I definitely am. Today's been really, really busy. So you're all here to learn about maternity care options. So the choice of maternity care is probably one of the biggest decisions that you'll make in your pregnancy. By and large, your maternity care option that you choose will determine where you give birth, perhaps how you give birth, and who you give birth with. And they're all quite significant decisions when you're having your baby. Very broadly speaking, we've got two different options for care. You can have private care or you can have public care. And they're both quite different, but maybe not in the ways that we are thinking at the moment. A lot of people think that going private means a private hospital, private obstetrician, but there's actually some other options within the private system that we're going to explore today. But briefly, to start with the public system and look at what's involved in public hospital care. Generally speaking, what that would mean is that you would give birth in the hospital that's closest to where you live. Generally, you won't have a choice of hospital, although in some cases you do get a choice. So if you live, for example, in Canterbury, then you give birth at Canterbury Hospital, but if you have a lot of risk factors or complications, they may move you on to Royal Prince Alfred Hospital. So by and large, there isn't a lot of choice in the public system. However, the care is free and it's at a very high standard of care. So we're very fortunate in this country that we do have a free health system which does deliver good standards of care. The other option is to have private care, and that's very different again. With private care, you do have full choice. So you choose who looks after you, you choose where you give birth. However, it's not free. Within the private system, there are two main care providers that you can choose. You can choose to have your own midwife, or you can choose to have your own obstetrician. Either way, you can receive some money back through Medicare for your visits, and whether you're seeing your midwife or your obstetrician, they would actually arrange all of your tests and your scans and your booking into the hospital. Yep, that's better. So, what are the differences when it all boils down to it? A lot of people think that some of the options are quite equivalent, but when we actually look at the outcomes, so the way that our babies are born, the way that we give birth, there are actually quite significant differences. I've just looked at a few different outcomes there that are sometimes important to women or maybe not important. Caesarean section rates are actually quite high if you're choosing to have a private obstetrician, regardless of whether you're giving birth in a public hospital or a private hospital. If you choose a private obstetrician, you have almost a 40% chance of having a caesarean. If that's what you're wanting, that's great. If you're not what you're wanting, then you might want to look at some of the other options. If you're choosing to be a public patient in a public hospital, your Caesar rate is a little bit lower, but still probably quite high by the World Health Organization standards. Private midwifery care has about the lowest level of caesarean rates. If you're looking at being induced, so that's not going into labour on your own, but actually having medications to start the labour for you. Just over a quarter of women will have an induction if they're choosing to go through the public system or with a private obstetrician. Going through a private midwife is a bit lower, it's about 14%. There are all sorts of reasons why labour might be induced. It might be high blood pressure or diabetes or concerns about the baby's growth. But generally speaking, your chance of being induced would be lower if you had a private midwife. An epidural, do we all know what an epidural is? Yeah. So fairly high rates with a private obstetrician, close to 70%. Now some of that will be women wanting an epidural, some will be just that's what's done. Women choosing a private midwife, it's the other end of the scale, it's only about 5%. And women who are going through the public system, close to about 50%. The chance of having a normal birth, so a normal birth is where you give birth without the use of forceps or a vacuum or caesarean. With a private obstetrician, it's slightly less than 50%. So I guess we need to think, is that really normal if less than 50% of women are doing that? With a private midwife, that rate is about 90%, and then going through the general public system, you're looking at about 65%. No stitches after birth, which is what a lot of women aspire to. Fairly likely going through with the public system or with a private obstetrician that you will actually have stitches after birth. Probably looking at about 80% likely. With a private midwife, you're unlikely to need stitches after the birth. 65% of women don't need any. Having a drug-free birth, that's no gas, no morphine or pethidine, no epidural, just using natural forms of pain relief. Only 4% likely with a private obstetrician. So 96% of women who have a private obstetrician will have some form of pain relief. And if we look up here, Most women will actually have an epidural. The rest probably use, morphine or pethidine or gas or something like that. Women going through the public system as a public patient, 90% have drugs in their labour. With a private midwife, it's the opposite end. Most women actually have a drug-free birth. There's various reasons behind those rates. Looking at the public system in a bit more detail and what it means for you and for your birth, it's free. So that's always, a really good option because you don't have to pay for it. And I guess there's a lot of other expenses with having a baby, which you're probably finding out about today. So if you can have free care, that's obviously a really good thing. In Australia, we're very fortunate that we've got a really good record of safety for mothers and babies. So by and large, if you're giving birth in a public hospital, you will be safe and your baby will be safe. So I think that's really great that we can say that. Options for care, if you're going through the public system, a lot of women will choose to have shared care. What that means is that they have their pregnancy appointments outside of the hospital. So rather than going to a busy antenatal clinic where there's long waits for each appointment, you can actually have your care outside of the hospital, either with a GP or with a private midwife. And regardless of whether you're choosing the GP or the private midwife, it's billed through Medicare. So there's no cost for that option. But what you get is one person looking after you for your whole pregnancy, and you avoid all the long waits in the antenatal clinic. The other option is that you might want to go through the antenatal clinic and just have your care coordinated from the same area. It also gets you a bit more familiar with the hospital where you're going to give birth. And then a few hospitals offer some continuity models where your care is by a small group of midwives, I should say, and they do all of your pregnancy, labour, birth and postnatal care. So there's a few different options going through the public system. The options that are available for you will depend on where you're giving birth. So not all hospitals offer all of those options. Certainly shared care is offered with most hospitals. This option isn't with all of the hospitals though. Moving on, that's right. Moving on and looking at the private system and what that includes, we've actually got two very separate options. Private obstetric care, a lot of people are very familiar with. Private midwifery care is new. Since 2010, we've actually had access to Medicare benefits so that women can claim private midwifery care through Medicare. Private midwives are also able to order all of the tests and ultrasounds that might be needed for your pregnancy and your birth and for your baby. And private midwives can also prescribe. So a lot of really great benefits to seeing a private midwife because you get complete continuity of care. Private midwifery, as we saw before, has lowest rates of intervention, which is important for women who might be wanting a natural birth. Generally speaking, there is a lot more postnatal care if you have a private midwife because there are services up until 6 weeks. So you may get 12 home visits, for example, with a private midwife. Appointments in the pregnancy are generally a lot longer. They're about an hour. So there's a lot of time for education, preparation, all the questions that you might have, lots of discussion, lots of time to talk and really get to know your midwife. There's a choice of home or hospital birth. A lot of people are thinking that if they have a private midwife, they have to have their baby at home. But we're actually able to do births in hospital now. So many women are actually choosing to have their own midwife, birth in the hospital, and then come home again. Why would you choose to have private obstetric care? Some people prefer to have their own doctor. They want to know which doctor they're going to have, for their labour and birth. There are, however, higher rates of intervention if you're choosing to go down that path. And for some women, that's actually what they're after. There are some women who really do want to have an epidural or a caesarean, and they would like to be supported in that. So it is a valid choice for some women to make. But I guess the idea of this slide is just to highlight that within the private system, going private can actually mean having your own midwife, or it can mean having your own obstetrician. With private obstetric care, if you're choosing this option, your labour and birth care is actually with the midwives at the hospital, and the midwives at the hospital will call your doctor when it's time for birthing. With the option of private midwifery care, a lot of women would say, well, what happens if I need a doctor? It's all good and well having a midwife, but what happens if I do need a caesarean? So in order for midwives to actually be working in this model and having access to Medicare benefits, midwives do need to be working in collaboration with an obstetrician. So there is that obstetric backup if it's needed. Private midwifery care, we've already talked through some of these points here. There are many women who are thinking that to have a midwife, they have to be low risk and completely healthy. We're actually moving away from that now, and we're running private midwifery models for women of all levels of risk. So you'll see private midwives looking after women with twins, triplets, high blood pressure, low blood pressure, women who go overdue, women who have diabetes or high blood pressure or epilepsy or any other health concerns. If you do have a pregnancy that would be considered to be higher risk, your midwife will involve an obstetrician in your care so that you can access that care that you need. Fees for private midwifery care, it really varies midwife to midwife. You're probably looking at a gap of about $2,000 to $4,000, which would probably be quite reasonable considering you get 10 months of care with your midwife. If you're choosing shared care with a private midwife, there's generally no cost for that. So you're just going through Medicare, a bit like seeing a GP for shared care. What you get for your fees, you get 24/7 access to your midwife for urgent issues that might come up. You get hour-long appointments, usually lots of resources to help with your learning and understanding of the process of pregnancy and birth. Birth debriefing, so talking through your birth afterwards and things that you might want to do differently. Birth planning, birth preparation, all of your clinical care, all of your labour and birth attendance, and visits at home after your baby's born. Eligible midwives are a type of private midwife who have met an additional registration standard, and they are the midwives with whom you can actually get Medicare benefits, and they will work in collaboration with the doctor. Sorts of benefits to you, we've already outlined them. Your midwife can actually prescribe medication for you, so any medications that are needed for your pregnancy or your labour or your birth. They can order all of your tests and scans, so basically as soon as you have your positive home pregnancy test, you can make an appointment with a private midwife. They can confirm your pregnancy for you and get you started with any tests and scans that you might need. Eligible midwives can admit women to hospital for a hospital birth, and it's full care throughout your pregnancy and labour and birth and afterwards. Private obstetric care, fairly similar. You have all of your care with a private obstetrician. You book in, they do all of your tests and ultrasounds. They arrange all your booking into the hospital. The out-of-pocket cost varies quite a lot. It tends to be more sort of expensive, I guess, on the eastern suburbs and North Shore. South, west, sort of Nepean area, it tends to be a bit cheaper. So hence there's a very big range there. Really the best thing to do would be to phone around some midwives or some obstetricians, ask them their fees and work out, what's workable for you with your budget. Alrighty. If you do have any questions during your visit here today, you can find me over at the Meet the Midwives stand, which is just down this way. We have a birth pool in there as well. If anyone's interested in water birth, we can talk you through all of that. And we're going to have this baby today. Thanks, everyone.